So this is acid base. So what does our body do all day, every day? All it does is does the balancing act. It senses what's going on in your body and the outside world. Your brain interprets it, and then there's a motor descending fibers that that will effect a change. That's why the descending tracts are called effectors, and of course the ascending tracts are called sensory. So pH is one of those things, and your body deals with pH via chemoreceptors. So it looks at chemicals. And what chemicals do they look at? They look at these two things, hydrogen ion and hydroxide ion. And the hydrogen ion is H plus, and the hydroxide ion is OH minus. Now, if you have a ton of H pluses, that means you're acidic. If you have a ton of hydroxide ions, that means you are alkaline or basic. So that's that's a primary question. And don't worry about that. Let's try to see if they have a nice, and here you go. Here is the pH scale. Human beings are around 7.4, which is around here. And that's where we should be. You should be around here, balanced. And like I stated earlier, if you're to the left of this pH scale, that means you're acidic. Okay? And the closer you are to 0 or 1, that means you are very acidic. So milk and eggs, mildly acidic. Vinegar, lemon juice, if you've ever gotten in your eye, is pretty decent acidic. Now, why does it hurt, and why are we concerned? Because H plus is an ion. It's highly reactive. If you recall your Anatomy and Physiology 1, week 2 lecture, when we talked a little bit about chemistry, ions are highly reactive. So if I put my fingers in milk, it's a mild acid. It's not really going to react too much. But if I put my fingers in gastric fluid, which has a pH of 1, or battery acid, what will happen? It'll eat up my fingers because there's a ton of hydrogen ions. And you could see what pH really means. pH is the negative log of the concentration of the hydrogen atom. So what does that mean? Negative log. Log is whatever power this is to. So you know that 10 to the negative 7, 10 to the negative 6, 10 to the negative 5. If you look at mathematically, the power is what? 7, 6, 5, 4, 3, 2, 1. So the negative log means, so you could see how the numbers are getting bigger, right, as they go here. The easiest way to look at it is this line right here. So if I ask a question, where should your pH of the human body and human blood be? Around here, 7.4, 7.35 to 7.45 to be exact, but around here. Where's gastric fluid? All the way over here, pH 1. And of course, vinegar and lemon juice somewhere in the middle. Now, what's the exact opposite? Hydroxide ion. Now, the closer you go to 14, the more basic or alkaline it would be. So if I put my hand in baking soda, it's no big deal. Milk of magnesia, no big deal. But put your hand in liquid drain cleaner and bleach, stick it in there for a little while, it's going to react and it's not going to be pleasant. Okay? Especially if you put household bleach or liquid drain cleaner in mucosal lining or your eyeball. So you could see how highly reactive hydroxide ion is as well, okay? And you could also see why we use bleach as a disinfectant, because most things like to live where? Around here, right? If I put things, because if I wipe down bleach, what will happen to most of the bacteria? It's going to do what? It's going to die because it is not in it is not in its proper pH. So now you know what pH really means. It means the negative log of the concentration of the hydrogen ion, meaning that goes 7 is neutral, closer to 1 is acidic, closer to 14 is basic. So right off the bat, that's an easy peasy question for your final or for NCLEX or anything. If my patient has a blood pH of 8.4, is that regular? Nope. My patient is now basic. It's alkaline. Not good. You'll learn later in pathology that it has a whole bunch of implications, especially with your capacity to hold oxygen and carbon dioxide. And what if my patient has a pH of 5? My patient is acidic. Okay. Now, here's the neat thing. What happens if I put H plus and OH minus together, right? If I took a base, which is OH minus, and an acid, which is H plus. If I put it together, it makes H2O. And H2O is water. Where's water? It's us. We're made out of 2/3 of it. And the pH of my blood, which is a good representation of my fluid volume in my body. If you remember the definition of your hematocrit, that's around 7. So that's the pH. Now, what is a buffer? Remember, in homeostasis, we're always a little bit out of kilter. So your body's going to want to do what? It senses the H pluses and OH minuses and always balances it. So let's go back to that patient earlier who has, now what's a buffer? A buffer is either a weak acid or a weak base that's going to help push your body back to homeostasis, back to the middle. So let's say my patient's 8.5, they're right here. Okay, so what's my body gonna do? My body has a chemical reaction, right? And to push me back, and those are called buffers. And we're gonna talk about the different kinds of buffers in a minute. But let's say, for example, I am slightly basic. If I'm slightly basic, your body's gonna release a mild acid or a weak acid. So what's that gonna do? It's gonna push you back to 7. What will happen if my other patient who had a pH of 5, that patient is acidic, a buffer will get released, which is slightly basic. So what will it do? Push, and bring my patient back. And that is in a normal patient. There are also respiratory compensation. So there's 2 compensations, which is a beautiful both A and B question. One is chemical, and that's buffers. And the other is respiratory. So here's an example, right? My patient's working out, right? What's gonna happen? The muscles are gonna start building up in lactic acid, right? That's why when you run without stretching, or maybe you didn't have it worked out in a while, you get crampy because in your muscles, you're gonna have increase of lactic acid. So it's like boop, boop, boop. My patient's starting to move here. But when you're working out, I hope you're breathing. When you're working out, what are you doing? You're throwing carbon dioxide. Well, guess what's really neat? Carbon dioxide hooks up with hydrogen ions. So when I work out, I'm acidic, but I'm also breathing. And what will that do? It will push my pH closer to 7. So when your patient is acidic, there's going to be a compensatory mechanism of increase in respiratory rate so that the carbon dioxide combined with hydrogen ion, right, which makes carbonic acid, and then you breathe it out. That's why you see these dudes and dudettes in a gym. Well, I never saw a female gym member pass out, but I've seen a lot of dudes pass out because they try to lift weights that are way too big for them, and then what do? Right? They don't really breathe when they push weight. They hold it all in. So if I'm holding it all in, what will happen to my pH? And then what will my body do? My brain will be like, oh, you're gonna push my pH all the way to the level of vinegar? Well, I'm gonna shut down for a while. And they're always doing I've never seen anybody faint on bench press, but they're always doing deadlifts, and the ridiculous. They don't even warm up, and it's funny to watch. Like I said, I've been a gym rat since I was 12, so I I watch silliness. And I'll be honest, I was part of the silliness when I was younger, but now I'm in the gym. You go in, you go out. You don't talk, you don't hang out. You do business and you leave. But there's a whole bunch of people. They go there to look good, and they crack me up. Nice entertainment. Now, what happens if my pH is acidic and my compensatory mechanism is fast breathing? What will happen if my pH is basic or alkaline? My breathing will then do what? Will slow down so that I can keep hydrogen ions. And if I do that, what will happen? Boop, 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 and it should bring me back to normal. And again, this is in a normal patient, okay? So now you could see it's really important to take your vitals, to take them regularly, right? You'll see once you get used to taking vitals, you'll see it as a chore, but there's a reason why we call it vital, al pertaining to vita, life, okay? So we now know what acidosis looks like, alkalosis looks like on a pH scale, and what are the buffers. So what are the type of buffers? Let's look at some of these buffers. These chemical buffers. And I mentioned carbonic acid, right? And the bicarbonate system. So carbonic acid is a very weak acid, and bicarb is a very weak base. So if my patient, let's go back here, is acidic, okay, right? Sodium bicarb will then push them back to here. If my patient is slightly basic, carbonic acid will push them back here. So that's the first buffer, carbonic acid, bicarbonate. And you've heard of bicarbonate. If you watch movies, they're like sodium bicarb push, you know, like when they say stuff like that in the ER. Because why? My patient is acidic. And going forward, you're gonna have to memorize this once you get into your biochemistry and stuff like that. But you can also see how carbonic acid, CO2, combines with water, and that's why you're breathing it out. So if when I breathe it out, you see it got hooked up with this hydrogen ion, and it got hooked up with the hydrogen ion, it will release hydrogen ions. And if it releases hydrogen ions, what will happen to my balance, right? I got a lot of hydrogen ions. I start blowing them out via respiratory. Back to normal. Another common, I already mentioned lactic acid. Ringer's lactate, that is also a mild acid. So that when we go here, right, if I give my patient Ringer's, right, Ringer's lactic acid, what will it do? My patient's basic, and then it'll go, boop, 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 bring it back to here. So that is another buffer. You also have the phosphate buffer system, okay? That is another buffer system. And looky here, right? It's also related to your adenosine triphosphate, ATP, okay? Because remember, ATP is phosphate bonds, and they're high energy bonds. So this is another reason why you have to keep the balance, right? Because again, too much of a good thing becomes a bad thing. Too little of a good thing is always a bad thing. Okay. So now let's go back. We have some buffer systems. We went over what buffers are and some buffer systems. And now you know the respiratory regulation of acid-base balance. If you're acidic, you'll start breathing faster. If you're basic, you'll start breathing slower. Guess what we also do with mechanical ventilators as well? We can control your pH through your mech vent. That's another strategy we have. Now that is, I showed you a little bit about the respiratory regulation of acid-base balance or acid-base homeostasis. A little bit about the chemical. Let's talk more about the chemical and the role of your renal regulation of acid-base balance. Now, overall, renal regulation of acid-base balance is simple. We already know that the kidneys can, it filters blood, and we already know the other two corollary functions of the kidney, which is secretion and absorption. So a kidney can do what? Can take in hydrogen ions, right? If I'm too basic, and if I'm too acidic, it can throw out hydrogen ions. And it could do the same thing with, because if you mess with hydrogen ion, you're always going to mess with hydroxide ion, right? It's part of that equation that we just showed, and it's part of the balance. So the renal regulation of acid base is also important. So if my patient has kidney problems, what can't they do? They cannot regulate acid base very well. Okay. So let us look at how the kidney does it. Now, we already talked about the RAA system, the renin, aldosterone, angiotensin. Let me find my picture that I love so much. Here is my picture. And why is it? Maybe this one's a better picture. There you go. Copy image. We already know about this. Now, looky here. We're back to this part. Aldosterone. You see what aldosterone can do for us? Increase sodium and water reabsorption, and also the secretion of potassium and, looky here, hydrogen ion. And who does that? Well, the adrenal cortex, once they get signals from the kidney that, hey, we have too much H+, what will it do? It'll throw out hydrogen ion into our urine, which is also a good thing because it also matches up with increased volume, and then should raise my blood pressure a little bit, right? Assuming that I have dehydration and sodium deficiency. So right here is direct evidence of what the kidneys does, along with your hormonal system, right, which is also part of your signaling system. And remember, there are chemoreceptors in several key places, but the main place regarding chemoreceptors for acid-base balance is your kidneys. Okay, so that is what the kidney does, and you can add that now. Well, you already should have this box in your mind's eye, and this as well is a beautiful diagram. Just a quick review. Beautiful diagram, lovely, lovely, lots of questions that we can have here for the final exam, because this not only regulates blood pressure, the RAA system, now you know, also regulates acid base. Okay. Do not save. We already have that pick. Rid of this. Now I'm back to here. Now, let's jump down to chapter 26.4 in your textbook, 26.5, because we're now going to talk about when things, a little bit of, in the past I used to not talk about this, but at the request of Dr. Bettini, in her pathology class, they go over this, and this is one of her high valued topics. So 26.5, let's go to that. I'm going to go into OpenStax, your textbook, right here, your main page. Table of contents. I'm going to go all the way down to 26. Okay. Okay, so right now you don't have to memorize this stuff, but you could see now you need to be in balance, because what's it going to do? It messes with multi-systemic problems. And as you already know from Anatomy and Physiology 1, all of your, everything is a multi-systemic problem because all of your systems are linked to each other. So you mess with one, like the acid-base balance, you can now easily see how it messes with everything. Okay. And remember, there's also a nice little balance of chemistry, right, up in your brain. You ruin acid-base balance, it's easy. Try running as fast as you can without stretching. See how it goes. See how well your brain and your respiratory and your cardiac system works. Also, your muscular system, cramping and pain, it's not fun. Let's look at metabolic alkalosis. Now, if we look at, remember, there's a metabolic and there's a respiratory component of acid base. Now, metabolic alkalosis means osis, abnormal condition of alkaline. My patient is too basic, and they're too basic because of some sort of metabolic process. So can primary bicarbonate excess? So I could have a question that states, my patient has way too much bicarbonate. If they have way too much bicarbonate, their pH should be above 7.45. That makes sense, right? And that's alkalosis. And you know that bicarbonate is a chemical. Chemical is what? Part of your metabolism, okay? And that's not good because remember, we need to be in the middle. How about if it goes, now what's metabolic acidosis, right? Makes sense. My bicarbonate is deficient, right? And I would have a pH less than 7.35. That's the worst I'll do to you. If I said my patient has a bicarbonate deficiency, what will you tell me? That's got to be metabolic acidosis. If I said my patient has a blood pH of 7.10, or let's make it obvious, 6.9, right? That means what? They're acidic, and I could tell you a decrease of bicarbonate, and you'll tell me my patient has metabolic acidosis, and vice versa for metabolic alkalosis. Now, respiratory acidosis, right? Of course, the primary issue is what? Acid. The pH will be less than 7.35, right? And what will they have? They'll have an excess of carbonic acid, right? And what will you what will you start thinking of? Start thinking of carbon dioxide excess. So these are things that mess with breathing, okay? Because if you have CO2 excess, are you breathing very well? Odds are you're not, right? Odds are your respiratory rate is very low. And if your respiratory rate is low, you're gonna build up way too much carbon dioxide. And remember what carbon dioxide is linked to, H plus or hydrogen ion. So that's respiratory acidosis. Think COPD, chronic obstructive pulmonary disease, or cor pulmonale, which is congestive heart failure or right-sided heart failure. And that's respiratory acidosis, okay? Now, what's respiratory alkalosis? It's the exact opposite, right? They have a CO2 deficiency, right? Why? Because they're breathing, they're kicking out way too much CO2. Now, who kicks out way too much CO2? Well, you can memorize all these things, but the one thing that I'll be telling you is someone's breathing really fast. Okay, so someone who's hyperventilating. So that's anybody extreme emotional, right? Also, when you have a fever, when you have an infection, you have a decent increase in your respiratory rate, right? So this is one way to look at your pathologies, okay, of what is missing. And in metabolic, think bicarbonate, or what is missing or what is increased. And in respiratory, I want you to think CO2. And CO2 linked to hydrogen ion is carbonic acid, okay? Now, what's kind of important for you future nurses is these compensations. Okay, and we already talked about a compensatory. Now let's look at, let's see if they'll go through arterial blood gas here. Hey, what's going on? No, I don't care for this. No. And you could sit and try to memorize everything for future reference. I wouldn't do that. What I would do is you look at the primary issue. So knowing that, let's get out of here. And let me find my favorite nursing video. Now the stuff that I went over is right. I'll put this video up, and this is a nice little introduction on. Now again, this is my disclaimer: arterial blood gas will not be on the exam. Everything prior to this will be on the exam. Okay, let's get that straight. But I wanted to go over this so that for future reference, when you guys get into your pathology class with Dr. Bettini, you won't be like the first time you'll ever be seeing this. Okay, so which one is this? The one I like? I can't remember which one I like. Let's do the 6-minute one.
All right, in this video series, I'm going to go over ABG interpretation or arterial blood gas interpretation. So this is a topic that all nursing students will definitely need to know. And my goal is to help you feel very comfortable solving these problems and getting them right on all your exams. So I have a number of resources available on my website to help you if you can use some extra help with ABG interpretation. I have an ABG interpretation kind of guideline, which has all the normal ranges and what it means when things are not in the normal range and how to go about interpreting the ABGs. I also have practice questions on my website that you can work through independently. I have an answer key there as well, so you can check your answers.
And I'll have this link.
Or you can work through those problems with me, because I will be working through all of those problems one by one in this video series to make sure everybody is really comfortable with ABGs. So before I get into specific practice problems, I want to go over some foundational information that's going to be really important for you to know before you get into those practice problems. So let's talk about the 3 important components of an ABG result that you need to really pay attention to. The first is the pH, and the normal range for pH should be between 7.35 and 7.45. Then we have PaCO2, which when you see this, I want you to think about the respiratory system. PaCO2 should be between 35 and 45. And then lastly, we have bicarb, which is HCO3. When you see HCO3, I want you to think about the metabolic system. HCO3 should be between 22 and 26.
Now, do you guys notice that 35 and 45 are like the last 2 digits of this? It's a common thing memorization-wise. You know that pH should be like around 7.4. So you split the difference at 7.35, 7.45. Then you have 35, 45 is the partial arterial pressure of carbon dioxide. That's what PA means. And PAH means the negative log of the concentration of the hydrogen ion. And of course, this is bicarb.
Okay, so these are the 3 values that you're going to pay attention to, and you definitely need to know those normal ranges. So what does it mean when these are not within the normal range? Let's talk about that now. So with pH, if pH is less than 7.35, that is indicative of acidosis in the body, okay? And if pH is over 7.45, that is indicative of alkalosis, being present in the body. With just looking at the pH, we don't know who the culprit is. We don't know if it's the respiratory system or the metabolic system. All we know is that we either have acidosis or alkalosis. Then we can read these values to really figure out whether we're dealing with respiratory or metabolic acidosis or respiratory or metabolic alkalosis. So with PaCO2, if it is under 35, that is indicative of alkalosis. If it is over 45, that is indicative of acidosis. And again, when we're talking about PaCO2, think the respiratory system. For HCO3 or bicarb, if it is under 22, that is indicative of acidosis. And if it is over 26, that is indicative of alkalosis. And again, when you see HCO3, I want you to think about the metabolic system. So you have to know this information before you can effectively work on those practice problems and interpret the ABGs. So I handle ABGs in 3 steps when I do it. The first step is to determine, based on the pH, whether I'm dealing with acidosis or alkalosis, okay? So I look at the pH and I determine, where are we? Or do we have acidosis or do we have alkalosis? And then the second step is figuring out who's to blame for that acidosis or alkalosis. Is it the respiratory system or is it the metabolic system, okay? So if I find out I have acidosis up here from looking at the pH, I need to figure out, is it the respiratory system or the metabolic system to blame? If I find that PaCO2 is over 45, I found my culprit, okay? Because if I have a PaCO2 over 45, that indicates acidosis and I know the respiratory system is to blame. On the other hand, let's say this is normal, okay? This PaCO2 level is normal. And down here with bicarb, I have a bicarb that is less than 22. Well, then the metabolic system is my culprit and what is causing my acidosis. So again, first step, do I have acidosis or alkalosis? Second step, who's to blame? Who's acting up, okay? So let's say in our hypothetical example, we have acidosis and the respiratory system's to blame, okay? I'm sorry, right here, PaCO2 is over 45. We have respiratory acidosis. The third step in the process is to figure out if we have compensation. So if the respiratory system is acting up and giving us respiratory acidosis, the third step is figuring out if the metabolic system is trying to compensate, is trying to fix the problem. Is the metabolic system just chilling out and not doing anything? Are they trying to compensate, or have they fully compensated for respiratory acidosis acting out? So that will be the third step. So these will become more obvious, and you'll be able to work through these 3 steps as I work through the practice problems.
So I've seen 5-step ones, but this one, I like this one as well. This is 3 steps. So you could see now, that's what happens when there is when there's a pathology. You're going to have the pH. You always look at the pH first. And again, this is not only good for exams, because when the physician or whoever's your supervisor, right, asks you, hey, did you look at the ABG? They don't want you just to spit the number, because I could look at the number. I need an interpretation, right? And one of the things they ask you, what's the primary problem? And then you have to tell them whether it's acidosis or alkalosis. And that's the easy part. And then there's going to be what she said, who's the culprit? So, or if you look at other ABG videos, you will look, the culprit is, who is the primary defect, right? Or where's is it acid? It goes, and whether they match or not, right? So in her case, patient who had a pH less than 7.35, PaCO2 was greater than 45. So the respiratory is the culprit, the respiratory is the main. And then you look at the metabolic to see if there is partial or full compensation. And the exact opposite can also be true. Let's say, for example, yes, we found acidosis, but The bicarb was less than 22, and then you look at, and that was the main culprit. Then you would look at the respiratory. So you could see how these two, the metabolic and the respiratory, they work together, right? And like I stated earlier, all these systems, it gets confusing because all these systems are linked together and they mess with each other. So that's essentially ABG, and that's also another neat thing that someone could ask: what is the arterial blood gas? And you'll go, oh, it's the ABG has pH, has partial pressures of CO2 and O2, and has bicarb level. What can it tell you? It can tell me the primary acid base issue with compensatory. Right? You speak like that, you talk like that in the ward, you'll be fine. Right? But if you start doing this to me, well, this is 7.35, this is 35. That's what I usually get from newbies, and because they're too nervous to ask and to answer. And again, this is a high value topic in nursing and in NCLEX. And it's really neat. It also shows how we make decisions in pulmonology, or not even in pulmonology. This also can be utilized a lot in cardiology and also nephrology as well. So let's look at, did we go over everything that we went over? Let's look at our goals. Oops, not that. It was task. Because of course, what's due next week, your very last, well, last with me, right? So do we know what pH is? Yes. Do we know what acidosis and alkalosis is? Yes. Do we know the buffering systems? Look in your notes right here, the Carolina notes. Yes. And that video I'm going to put up, because do you know how we compensate and how your body corrects for it? Yep, we do. So that covers all the topics for our tasks, okay? And of course that is due by closing of business next week. And what's closing of business next week? It's the end of the week. So I got to get in grades by, like, I think they said Saturday, but I'm trying to get in all my grades by like Friday, because remember, I got term 1. I have to start prepping and setting up stuff for the next set of classes. Now let's look at, you guys are pros at the discussion already. Let's look at some of the stuff they were showing in lesson 9. pH and buffers, nice video here. Difference between respiratory and metabolic. This link doesn't work, but I'll be putting up a link for that ABG. It's more important than this video, corny video. This is, here, they added this one. Never saw this one before, but I'll have this one also as a dead link, but I'll have that video that we just discussed as well. And this homeostasis and pH lab, of course, more notes. Again, we're not doing that lab. Okay. And of course, respiratory distress, the questions are pretty straightforward, just like always. And again, final exam won't be this link. This is a nice online exam that they made, but mine is tailored to what we discussed, and it has pictures and it has all these other things. So if you want to mess with this one, yeah, this is nice to practice with. And also I have the another practice exam, but the real exam will be on Moodle. It'll be posted up and it'll say the real exam, and it'll be posted up like 10 minutes before 9 next week. And that should be that. Let me put this link and let me stop the video.